Welcome back, everyone. If you have been following our journey into health technology assessment, you already know that we have laid a strong foundation understanding what health technology assessment really means, its scope, its pillars, and the crucial role it plays in shaping responsible, data-informed healthcare systems. We also mentioned in our last episode that if you are working in or with healthcare sectors, this information is critical for you because health technology assessment will be the only way to make decisions in the healthcare systems. And this will happen very soon. Whether these decisions are related to inclusion of new medications or adopting new initiatives or even maintaining a standard medication in the formularies. Now, in this second tutorial, we will be taking a step forward from understanding what health technology assessment is to exploring how it actually works in practice. So we will start first by sharing the timelines of health technology assessment evolution. How did it start? Where is it now? And then we will shift the gears and share real-life examples from different countries across the world, in order to have more clarity on different models and applications of health technology assessment. It is important to know that understanding where health technology assessment came from and how it evolved helps us to appreciate the sophistication, if I can say so, it brings to the modern healthcare systems. And this is not just watching timelines, it's a reflection of how healthcare itself matured through trial, structure, and innovation. So let's get started, and we will start probably in the early 2000s. In the early 2000s, the first health technology assessment framework was established. By that time, the healthcare systems worldwide were under growing pressure. Costs were rising, technologies were flooding, and decision makers faced a key question. How do we decide which technologies or innovations truly add value? Remember, in the last tutorial we said that when we mention technology and we are talking about health technology assessments, we mean any intervention, not only digital solutions. So by the early 2000s, the need for a systematic evaluation framework became clear in order to find a way to assess technologies by benefit, safety, cost effectiveness, and impact. And it's interesting to say here that health technology assessment was not born in one country or one agency. It was actually a global response to a shared problem, which was the need for evidence-based decision-making framework in order to decide regarding healthcare investments. This early framework brought structure to what was once fragmented by combining clinical data, economic evaluation, ethical considerations into one single frame or one single process. From this point, health technology assessment moved from a concept to a global conversation. A major milestone came in 2012 when the first comprehensive health technology assessment evaluation was published. And it was not an opinion paper, it was data-driven, multidimensional, and designed to influence national healthcare policy. This publication in 2012 was an evidence that proved that health technology assessment was not theoretical, but it was practical, impactful, and ready for the real-world use. By that time, governments, ministers, and regulators began paying more attention, and countries that had been experimenting with informal assessments began by 2012 to create dedicated health technology assessment bodies or to integrate the principles into procurement and reimbursement systems. So we can say that in 2012, this publication moved health technology assessment out of the academic journals into the real world of decision making. By 2016, Several countries were already practicing health technology assessment, but there was a challenge. Methods, definitions, and evidence interpretation all varied across different countries. And without alignment, the global collaboration became very difficult. So organizations, including the WHO, the World Health Organization, came together to establish what's called Global Health Technology Assessment Standards. And as expected, this alignment improved transparency, collaboration, and access. It turned health technology assessment into not just a national tool, but a framework for international health cooperation. In 2021, another important milestone was achieved, which was the integration of artificial intelligence tools into health technology assessment. And this was a transformative milestone, simply because health technology assessment is fundamentally about data. And healthcare data is massive, complex, and ever evolving. So now, with tools like machine learning, predictive analytics, natural language processing, health technology assessment can process data faster, spot trends earlier, and forecast real-world outcomes more accurately. When we talk about the integration of artificial intelligence into health technology assessment, it's important to mention that this integration is not to replace human judgment, but actually to enhance it. So what we can learn from this timeline is that health technology assessment is not a static science. It's a dynamic, adaptive, and continuously evolving with science and policy. Also, health technology assessment is growing in relevance and complexity, and its evolution is shaping the future of healthcare policy worldwide. Now that we have seen how health technology assessment evolved, let's explore how it's implemented around the world, because each country applies health technology assessment differently, influenced of course by the healthcare priorities, resources, culture, and political context. So let's look at few key examples and see how different the applications are. Let me start with UK because they have an interesting story. In the UK, health technology assessment is led by the National Institute of Health and Care Excellence, which is the NICE or the NICE. And this entity evaluates new drugs, diagnostics, procedures before they enter the NHS. The interesting story in the UK that really shows health technology assessment made a big difference is about a drug called nivolumab. Nivolumab is an immunotherapy drug used to treat several types of cancer. And it's a part of a class of medicine called immune checkpoint inhibitors, which work by helping the immune system to recognize and attack cancer cells more effectively. When this drug came to the UK, it was first assessed and it was rejected for cost effectiveness reasons. A story that happens every day. But after the UK applied the health technology assessment principles, including obtaining further data and price adjustments, it was reapproved, showing that health technology assessment has the power to balance innovation and affordability. Let's take another example in Canada, how the health technology assessment is managed. It is managed by the Canadian Agency for Drugs and Technologies in Health. What's unique in Canada is that there is a broad stakeholder engagement, including patients, clinicians, and policymakers within the health technology assessment framework, and they worked very well during the COVID-19 pandemic, where they used the principles to guide virtual care rollout, resulting in faster and more accepted and also more practical implementation. Another model for application of health technology assessment in Australia, the Pharmaceutical Benefits Advisory Committee integrated health technology assessment into public funding. When high-cost hepatitis C treatments arrived to Australia, they used the HTA or the Health Technology Assessment driven negotiations to link reimbursement to real-world outcomes. And this achieved universal access to those treatments, and major public health impact resulted from this. Another completely different model of application for health technology assessment is in Thailand, where they used health technology assessment to ensure equitable access through the health intervention and the technology assessment program. Their evaluation of the HPV vaccine went beyond the cost effectiveness. It included gender equity, social benefit, leading to successful nationwide rollout. So, as you see, the application is different from one country to another. However, the principles or the standards are the same. In many countries, in the emerging economies such as those in Middle East, Latin America, and Asia, health technology assessment has not yet fully implemented. However, the principle and the spirit of health technology assessment have already begun to influence healthcare decision-making process, and we see this every day, and we see it across these regions. It's widely accepted that most of these countries will gradually adopt formal health technology assessment frameworks, and I guess that this will happen quickly in order to help bring innovation and effective medications to patients who really need them most. Across the countries of the emerging markets, nowadays, health technology assessment is helping low and middle income countries to allocate limited resources wisely. However, full implementation is not yet happening. And there are regional collaboration, by the way, that is supporting these countries in this regard. Like, for example, the Africa Health Technology Assessment Initiative and a joint European Health Technology Assessment Project. These projects are building capacity, and reducing duplication. And this will ensure that evidence drives the decisions, not guesswork or gut feelings. From our side, we will dedicate a separate episode to discuss health technology assessment in the emerging markets, because it's critical for every one of us who are working in healthcare to understand what is coming, when it is coming, and how to be ready. Okay, across all these examples, a few universal lessons stand out. Health technology assessment increases transparency in decision making. It enables equitable access to valuable technologies and innovations. Stakeholder engagements improves relevance and trust. And most importantly, health technology assessment adapts to local context and needs. It's a scalable, adaptable tool that helps any healthcare system, whether it is big or small, to make smarter, fairer, and more sustainable decisions. So, ladies and gentlemen, that's what we wanted to cover in this short episode. And in our next episode, we will dig deeper into the framework and tools used in health technology assessment. Till then, have a good day and see you soon.